I am interested in this day because of the legislative session that's in place and the ability to come and hear from the leaders of the state in the political arena. It's something that we don't really get a chance to do. I'm from the far southwest part of the state, and coming here to Richmond and hearing about these policies and being here on a legislative day is very informative. There's a lot in legislation that affects medical care, and it is just good to have a day to focus on that.
Okay, great. How do you think you'll be able to use some of the lessons you've learned today?
Well, I think the take-home message for me has been to be involved. Not that we're so busy actually doing the healthcare and being with our patients, we often forget about what happens behind the scenes that affects policy. And I'm hoping to take some of that back and engage more with our local legislators in this whole process.
The day has been great. We've had Lieutenant Governor Bowling and Attorney General come and speak with us. The thing I've taken away from it so far that I think was invaluable is sort of getting their perspective on things, and maybe perhaps understanding a little bit more, especially from Attorney General Cuccinelli, about what his perspective is on why, particularly the suit involving the healthcare law, and also getting a perspective from Lieutenant Governor Bowling about healthcare in general in the state and how the legislative process is working. I think as physicians it gives us a better idea of how that process works, how we can get involved, which I think is overall great.
Well, it's a great opportunity to be a fellow with the Claude Moore Physician Leadership Institute. This is a wonderful opportunity today to be able to talk with some of our state leaders. This health care reform debate, which is a very fluid, dynamic process, is actually very intriguing for me, and it's something that I've been watching very closely. So it's actually a good thing to be able to be in front of these state leaders who are making these decisions. I think what will be important for me in taking back is just to involve not just myself, but also allowing patients to know that they too, may have a voice in what happens. They're the consumers of our healthcare delivery system, and they should be as involved as the physicians are as well. And I think that's one of the things that I would try to definitely make sure I take back, because I think that no matter what happens as far as government, we still, as physicians, our primary goal is taking care of patients, and to make that connection between between quality care for our patients and connecting with our state lawmakers, I think is a crucial bridge for better care.
It's been a great day. I've learned a lot. Not only the legislation that's going to be handed down, but I think it's been a great discussion. And I think that some of the points and some of the things that were brought up today were salient, and the committees will take them back and actually look at some things, have some new perspectives and aspects. So I think as much as we learned, I think they learned a lot as well, and it's great to have a voice for people that are actually making the decisions.
So I think the most important thing is we're beginning to work on the problems with respect to changing the healthcare delivery system and making it work better for the patients. The key parts was the Virginia Healthcare Initiative description, and I think just the general camaraderie as we begin to think about what each of our individual parts are and what are the next steps in healthcare reform.